Hi there, I am here to introduce our first speaker, Dr. Jennifer Nunn Tarbutton. She is a 2001 graduate of Mercer University School of Medicine and is the current chair of the Mercer University School of Medicine Board of Governors and a member of the Mercer University Board of Trustees. She's a native of Perry and completed her pediatric residency at Emory University, where she became chief resident in 2004. In 2007, she married and moved to Sandersville, Georgia. She is a board-certified pediatrician and has practiced at Children's Healthcare of Sandersville for the past 16 years. In July of 2019, Dr. Tarbutton represented Mercer University School of Medicine in Kurobe, Japan, where she provided lectures to medical students there about a variety of pediatric topics. She and her husband, Benji, have 3 children, 2 dogs, and are members of Sandersville United Methodist Church.
Thank you, Megan. I'm excited to be here today as a part of this Maternal Health Symposium, and Joan asked me to speak on the topic today of the healthy child and healthy child development. So let's get started with that. My first slide is a disclosure that Joan asked me to include to state that I do not have any relevant financial relationships or any commercial interest related to the material in this presentation. 3 objectives I would like to try to accomplish today for you will be able to recognize common categories of child development and normal milestones of child development. The second topic would be to be able to review early child development and the importance of environment and experience to support this development. And the third objective will be able to identify how medical providers, families, and communities can support children's normal development. To get started today, I wanted to show you this 8-minute-long video. It's a clip from a PBS documentary, and it opens the presentation by talking about how the brain develops in a newborn and a child.
When a baby is born, its brain is a quarter of the size of an adult brain. On the outside, it looks like a smaller version of an adult brain.
But if you look under the microscope, it's a very different beast. At the cellular level, we see that the neurons in the cerebral cortex of a newborn baby are very small and not well connected.
The neurons of a newborn look a lot like young tree saplings, standing unconnected, with short branches and a stubby root system.
In a forest of these saplings, they're not connected to each other, but by the time they grow up, the branches reach out and touch their neighbors, so you have this whole forest canopy that thickens.
The structure of a neuron is much like a tree. Its branches, the dendrites, surround the cell body, receiving incoming electrical signals from other neurons. The root, or axon, is a long cable extending from the cell body, transmitting electrical signals to other neurons. A synapse occurs when the axon of one neuron connects with the dendrite of another. The dendrites grow very rapidly in early development, causing the brain to grow.
In fact, that's the main reason babies' brains get bigger. They're not adding new neurons, but they are massively growing these dendrites, so their dendritic branch is growing.
By age 3, the brain will have grown to 80% of its adult size. By age 5, it will be 90% of its adult size. Brain cells are unique. Unlike other cells in the body, most brain cells cannot reproduce themselves.
Probably the most remarkable fact about brain development is that we produce all of those 100 billion neurons in just the first 2 months of prenatal life. So already by 6 months of age, the baby has all the neurons they're going to have.
And they look different than other cells.
The brain cells are quite different. They are long and spindly. There are neurons in your spinal cord that extend all the way down to your big toe. So they can be, a meter long. So the actual cell body, where the nucleus and the DNA is just a tiny little blip on this enormous long cable.
To help insulate the brain's electrical circuitry and speed up transmission, the neurons need a fatty substance called myelin.
Myelin is the white matter of the brain. It is largely not present in newborn babies' brains. It's added after birth. It's one reason we like infants to stay on a higher fat diet. The myelin literally wraps around this long cable of an axon, insulates axons, or neural wires. And so if you have two axons running alongside each other, the fact that they're insulated with myelin prevents them from interfering with each other.
Myelination begins around the time of birth in the cerebral cortex, but it continues all the way into our mid-20s.
Myelin is a marker of maturity. So once a brain area is fully myelinated, it probably loses some of its malleability or plasticity. Once the cables are all wrapped up, it's much harder for them to branch out and form new connections.
Recent research indicates that myelination may also be affected by experience.
So one of my favorite studies looks at a bunch of teenagers who are learning how to play piano.
The more the teenagers practice the piano, the thicker their myelin became.
You will actually have thicker myelin connecting your two hemispheres. Probably everything you're doing is, in addition to selecting the right synapses, it's probably also increasing the thickness of myelination.
Dr. Lise Elliott is a neuroscientist at the Chicago Medical School of Rosalind Franklin University. She is studying neuroplasticity, a neuroscientist's word for describing the malleability or flexibility of a child's brain.
It's like plastic, you can turn it to grocery bags and playground equipment. And our brains have tremendous ability to develop different circuits depending on the needs of the child in their early environments.
A young brain is more plastic or open to rapid learning and growth. So what's actually happening inside the brain? Elliott says the dendrites are at the heart of plasticity.
That's where experience is making the decisions. We've got a little branch growing along, am I going to go right, am I going to go left? Well, if something over here to the right is a circuit that's useful to you, like knowing the sounds of the English language, then the brain is going to grow and grow in that direction and solidify that circuit. If the alternative direction for the branch to grow is a sound in Hindi or Chinese, then the branch won't grow in that direction. So it's this massive growth of the branches that completes the wiring and sets down the circuits that we will use for the rest of our lives.
When it comes to wiring the brain, timing is also an important factor. Certain things need to happen at certain times. Scientists now know that starting before birth, waves of important critical periods or stages of development need certain types of experiences in order to wire up properly. These windows of opportunities open and shut at different times very early in a child's life. Surprisingly, even a baby's vision is not hardwired at birth.
If there's anything people might expect would be hardwired, it would be the sense of vision. Why not just open our eyes and have these camera images perfectly projected into the occipital lobe? But it doesn't work that way. Even vision depends on early experience. And so that's why we're very cautious with children who have any kind of visual problem. If a child has a weak eye, crossed eye, we call it strabismus, they tend to squint that eye. And when you squint your eye, you deprive your brain of vision. And when your brain is deprived of that electrical activity from the visual circuit, it literally cuts off the input. It literally loses connection to the eye. And if that problem is untreated in a child for the first year or so of life, they can end up functionally blind in the eye. The eye may look fine, but the brain isn't getting the connection. And this is very different from what happens in an adult.
An adult would not have this problem. If they develop a vision problem, once it was fixed, they would see normally again.
Your vision will go back to being what it was before. It doesn't have that unique sensitivity to the experience experience that a newborn baby's brain does.
Critical periods come with time limits. If the right kind of experiences don't happen at the right time, then essentially a child's brain will be operating with a handicap, struggling to make up lost ground.
So I thought that was a great beginning discussion to understanding a little bit about brain development in a newborn, and the importance of the first 5 years of life lays the groundwork for our discussion about child development. The development of a child is a complex topic. It's important for caregivers of children to be familiar with these normal patterns of growth and development in order to be able to recognize abnormal variants. Remember the critical periods that he discussed, as well as the time limits, and child development typically occurs in a sequential manner. In pediatrics, we have the goal to help each child achieve his or her potential for growth and development so they can become a mature, successful adult. And in order to accomplish this goal, periodic monitoring of the child for normal progression of growth and development and screening for abnormalities is important. As pediatric providers, we need to remember that being attentive in evaluation of these milestones and to be aware of any abnormalities that can lead to developmental or behavioral concerns is as basic to general pediatrics as the recognition of acute and chronic medical conditions. So how do we monitor child development? Starting at birth and continuing through childhood, children reach milestones in how they play, learn, speak, and move. They will develop at their own individual pace, but there are broad limits of normal times for developmental milestones to occur. Developmental milestones are grouped into 4 areas. There are motor skills that are fine and gross motor skills, cognitive skills, speech and language skills, and social skills, and those are the 4 broad categories for that. This is an example of a milestone chart. You can find these on the CDC website in your Harriet Lane handbook. If you're about to start your pediatric residency, you'll have that. Many times these are built into electronic medical records for pediatric practices. And you can see examples of the milestones that a child should reach in each of those categories I mentioned on the past slide. The screening of this is easy for a provider at each of the individual well-child checks that we have. You can take a history from the parent, or many times many of these milestones you can observe by the child for the child in the room. Skills chosen to be in these categories are achievable by greater or equal to 75% of children at corresponding ages. And taking a look at these milestones at each of the well-child checks is referred to as developmental surveillance. So there's discussion about surveillance versus screening. Developmental surveillance that we just talked about is important to do every time a child comes into the pediatric home or pediatric office. Developmental screening involves using a tool that has been standardized, and it's recommended by the American Academy of Pediatrics at 9 months, 18 months, and 30 months of age. This is just a flow sheet showing the AAP's expectations for pediatricians in order for us to screen for any of these abnormalities. The first office visit for an infant will be at birth in the newborn time frame. And metabolic disorders we screen for by reviewing their PKU, which comes from the hospital. That's the heel stick in the hospital. The state of Georgia screens for about 30 different inherited metabolic conditions. Also, hearing is screened in the hospital, and it's up to the pediatrician or the pediatric care provider for reviewing those tests and making sure they've passed their hearing screens and referring them out if they have not. The health supervision visits, of course, happen frequently in the first 2 years of life and then annually after that time. And in each one of those visits, we're looking for certain developmental disabilities. We have vision screeners that we start to use at a year of age. They can't participate. Most children can't participate in a Snellen chart exam until about 3 years of age, but there are some spot screeners now that can pick up on amblyopia or strabismus or anisocoria, and so we are using those in pediatric offices generally annually to check vision. And then you do the behavioral and emotional screening as well. Other screening tools, I mentioned the 9, 18, and 30 months of age. Those two, the most commonly used, are either the Ages and Stages questionnaire or PEDS response. Other screening tools that are routinely done at a pediatric office visit that I mentioned earlier: newborn screen, hearing screen, vision screen. And then we do lead screening at 1 and 2 years of age, and the MCHAT, which is screening for autism at 18 and 24 months. So those are standard screening tools that we use. This chart is a little bit dated, but what I wanted to show you here goes back to the prevalence has increased in the developmental and behavioral disorders, but you can see the difference in frequency of what's coming into a pediatric practice. You will more often see developmental and behavioral disorders than you will the acute and chronic medical conditions, or at least equally see those, just based on the prevalence that's out there. Two very common conditions that you will treat within a pediatric practice. Everybody's familiar with ADHD. It's the most common neuropsychiatric disorder of childhood and adolescence, characterized by symptoms of inattention, impulsivity, and in the case of ADHD, hyperactivity. Affects cognitive, academic, behavioral, emotional, and social functioning, and the estimated number of children 3 to 17 years of age ever diagnosed with ADHD is 6 million, or 9.8%. Autism spectrum disorder is the other most common that will be coming into the pediatric practice. Sorry, I moved that slide too fast. Autism spectrum disorder is a neurodevelopmental disorder characterized by persistent deficits in social communication and social interaction, with restricted, repetitive patterns of behavior, interest, and activities. The CDC reports the prevalence of autism has risen to 1 in 36 children, and screening, of course, occurs at 18 and 24 months of age. So, in closing this first objective that going over, I wanted to reiterate these points. 1 in 6 children aged 3 to 17 have developmental disabilities, and the prevalence of ASD, ADHD, and developmental delays have been increasing with time. So this talks about the importance of being able to recognize and treat these conditions. 90% of brain development happens before the first day of kindergarten. That's the second area once you start school that these abnormalities will be picked up. So the importance of a medical home recognizing these conditions before they start kindergarten is imperative. And then nationally, only 17% of children younger than 5 years of age with developmental delays receive services for these delays. And we do know that the earlier services have been received based on the brain's development, the way that the wiring of the brain occurs, and the plasticity and malleability that occurs before the age of 5. We know the critical period is before 5, so being able to refer and provide services before that time is so important. So moving into the second objective, talking about the importance of environment and experience to support development. You'll remember in the video they mentioned 100 billion neurons of the human brain are in place at birth, and talked about the brain dramatically increasing in size due to the connection, synapses, and myelination. By age 5 to 6, the brain is 90% of adult size, and the pruning that takes place to eliminate the unused axons, neurons, and synapses. Pruning, we think, occurs to whittle down to about 14 to 16 billion neurons from the 100 billion at first, depending on environment and experience. So that's what we're about to explore. There is a lot of discussion now over nature versus nurture and the influence on brain development. Science has shown substantial evidence documenting the importance of both nature and nurture in early brain development, and current research is working to understand the complex ways in which these two interact through the childhood years specifically. Nature is sometimes referred to as individual variability. It's the child's innate biological endowment and heredity. It consists primarily of genetics. Nurture is referred to as the developmental plasticity, how will the brain wire, and it's related to experiential factors such as maternal education level, family dynamics, poverty, child abuse, religious affiliation, and even birth order. These have the potential to nurture or mold the brain in functionally positive or negative directions through neurobiological mechanisms. Environmental factors have enormous effects not only on children's cognitive development, but also on children's behavioral development. Some of the environmental factors that we will screen in pediatric practice, obviously nutrition is there, and we could spend a whole day talking about that as well. It's a critical part of health and development, and good nutrition considers both the quality and quantity of foods consumed. And the definition of malnutrition includes both undernutrition as well as obesity. 1 in 7 U.S. children live in a household with food insecurity. I was surprised by that statistic, but certainly see that plenty in rural areas. Another area of environment that we screen regularly in a pediatric office is lead. Over the past 4 decades, lead has been eliminated from gasoline, paint, and other consumer products. Very high blood lead levels that you guys are learning about, probably studying for your boards, can cause vomiting, encephalopathy, and death. And you'll remember also, I can remember studying for boards and learning the chelation with the EDTA and dimer-caprol. But that's not what we're doing in pediatrics. Research now shows that lead levels even as low as 5 micrograms per deciliter impair cognition and can result in diminished intellectual and academic abilities and higher rates of neurobehavioral disorders such as hyperactivity and attention deficit. So we screen at age 1 and 2 with a finger stick check of lead level in the office, and we get results, and then are responsible for managing that if the levels are higher than 5 micrograms per deciliter. Okay, so I have another 10-minute clip from the same documentary, and still talking about brain development, but this is furthering the discussion about the importance of experience and environment.
So how do we build a healthy brain? Brain building is a step-by-step process. Simple neural pathways form first, and then more complex ones. Just like building a house needs a strong foundation, the developing brain needs a strong base to build all future learning.
If your foundation is not solid, you can have a really pretty house that's going to fall down in a windstorm or being cast aside. You've got to have that solid foundation.
The kind of care a child receives plays a big role in how the brain chooses to build itself.
Every interaction with a young child is a brain-building opportunity. There's nothing that's made. Everything is either supporting that child's development and saying, yes, you can, or saying, no. And so every interaction counts big time.
Experiences in the first years of life build either a strong or weak foundation for all future development. It determines whether a child gets a strong or worrisome start in life. So how does the brain build a strong foundation? One way is through serve and return interactions. Similar to a tennis match where a ball is hit back and forth, a caregiver and a child send various forms of communication. It could be a smile, a touch, a word, or a coo.
Every interaction is, you can talk about a serve and return. There's a rhythm, a dance, a simplicity between the caregiver and the child. And every interaction builds the child's skills and willingness to move forward.
Children really, really need another nurturing human being to interact with. But it's not just having the FaceTime, it's having a caregiver who is noticing what the child is interested in, noticing what their needs are, and responding to those interests and those needs and desires. And it's this kind of back and forth interaction, just like a game of tennis, just like the serve and return,
every time there is a serve and return interaction, children are picking something up from that. Every time a parent or a teacher helps a child name something that they're interested in, for instance, there's a process in the brain that's learning language through that interaction. And children learn best when they're able to feel a sense of safety and security within a relationship that helps them explore outward and not have to worry about those kind of primitive safety issues. And all of those interactions are helping form those tracks in the brain.
Every interaction really truly shapes not just the child's whole readiness, but it shapes their adult life, their adult health. It was just phenomenally impactful.
So what happens to the brain if a child does not get healthy serve and return interactions?
This is kind of a double whammy, because then if they don't have those serve and return interactions, those healthy, responsive interactions with their caregivers, then they're not only missing the kind of healthy input that they need to develop, but they can actually ignite their stress response system because what they're expecting to get isn't happening.
Stress is another kind of experience that shapes brain development. There are good kinds of stress, like trying something new or taking a test. And bad stress, or what experts call toxic stress, that damages brain development. Toxic stress is when a child suffers from serious ongoing hardships, neglect, or abuse.
When they're in an environment that's overwhelmed with stress, we know that that shapes the brain in very particular ways. You can end up with all kinds of problems in learning and behavior and your ability to function in relationships with other people as a result of that very early wiring that's impacted by toxic stress.
Toxic stress is, as it sounds, it is constant. It is kind of unrelenting. It is there all the time. It affects the function of the brain. Because what stress does is it raises your activation syndrome, it's called. When you see a tiger, you either freeze or run, fight or flight. And a little bit of that, okay, conditions your system. But imagine you're a child growing up and it's always that way. You're always stressed. I mean, it doesn't go away. You never have a chance to, relax, to breathe, because you're always on lookout. Children under those kind of circumstances either are overly afraid, overly frightful, or nothing bothers them because they're overwhelmed. They're overloaded. And neither thing is good.
We've learned that entering school ready for learning is critical, that kindergarten readiness idea. But we also know that it's not just being academically ready, it's not just the language skills or math skills that they come into school with. It is that social emotional readiness. Children who are experiencing a great deal of stress are emotionally aroused, and we know that blocks learning from happening. And if they don't have the social skills, the capacity to sit still, to regulate themselves, to participate in the classroom in an effective way, to pay attention and focus their attention. So those are self-regulation and social skills that we might overlook when we think of academic readiness or academic competence or educational attainment. But those are the foundation of those things. If a child's sitting in a classroom and they're stressed and they're emotionally distressed, their mind's on something else that's going on, they're unable to sit still, they're unable to pay attention, learning can't happen. And thinking about toxic stress in early childhood has kind of given us a new lens as a way that we view what children need. So not only do they need enriching opportunities to learn in the settings that they're in, but they also need protection from sources of toxic stress.
A strong brain foundation also supports the development of emotional and social skills.
How do I learn to not just blurt out what I want or grab something that I want or push my way? I'm civilized in that I make my turn and I breathe before I act. And it is part of a civilized society.
So we are going to play a game with these cards. It's going to be a silly game. When you see this card, I want you to say the word day. Can you say the word day? Good job. And when you see this card, I want you to say the word day. great job.
Skills like executive function and self-control are important for a child to develop to do well in school and life.
Executive function skills are the kinds of skills that help us focus our attention, to switch between different kinds of tasks, monitor our behavior, to self-regulate. And so those skills are really important.
Executive function in the brain works a lot like a control tower at a busy airport. The control tower, or young brain, needs to manage numerous planes landing and taking off. To avoid a crash, the child must learn to pay attention, plan ahead, and follow a lot of rules.
If you are not able to attend to information well because you're distracted, or you can't control your impulses, or you can't recall the steps of a sequence of something you might learn or be asked to do in a classroom setting, you're not going to be successful with learning. So it's really those foundational pieces that help us learn new information. And without those in place, it's very hard for us to take new information in.
Executive function also helps a child get along with others.
So much of our world is about being in relationship with others. And so children who have poor executive function skills have difficulty in friendships, have difficulty in peer learning situations because they are not able to take the cues of others well and organize their behavior in a way that's sort of pro-social. So executive function is really important for both that cognitive development as well as the social development of children. The rule of the game is no peeking. Try not to work.
Children are not born with executive function. It needs to be learned from their caregivers.
Executive function is one of those things that we have the capacity to develop. And in children, they're working really hard at building executive function. And it starts, right at the moment that a child is interacting with another person. So really in infancy, those responses that are, those sort of, we call them serve and return, those back and forth interactions, really set the stage for executive function development. And then we see a huge spike after children learn language in the preschool age group between 3 and 5. And any teacher who works with 3 to 5-year-olds will say, you see those kids working on things like impulse control and being able to transition and shift activities seamlessly. Those are things that kids are really actively working on. And then it continues to develop throughout life. It's one of the areas of the brain that develops the latest. And so we see another spike in development in early adolescence into early adulthood.
So you can see here that early experience does build the foundation of birth in this critical period of birth to 5 years of age. During that time, attachment to a stable parent figure is crucial for a child's normal mental and physical development. Remember the serve and return interaction they were discussing. I thought it was really interesting that maternal education level has been shown repeatedly to be one of the strongest predictors of developmental outcome regardless of the primary risk factor being studied. We know early and severe deprivation from typical bonding and attachment experiences have long-lasting effects on later behavior. And it seems to be there's an important sensitive period for newborns, infants, and toddlers to have a normal formation of these close relationships. So what does happen in the brain during a stress response, and many of us learn this during medical school, but when the fight or flight mechanism is activated and a person is under stress, the hypothalamus and the pituitary are there together. The hypothalamus, which is the command center directing the aircraft around, that sends a signal to your pituitary gland. The pituitary gland then controls your body's functioning by releasing hormones. And in the case of stress, that's the ACTH hormone. The ACTH hormone triggers the adrenal glands to release the stress hormones, adrenaline or epinephrine and cortisol. And transient increases in these hormones in response to stress are protective and essential to survival. But we know excessively high or prolonged elevations in the stress hormones are harmful and lead to chronic changes in the brain architecture that we'll discuss in just a minute. There were 3 different types of stress that have been identified. There's positive stress. This is mild to moderate intensity. It's brief or infrequent. Examples of this are beginning school or daycare, getting immunizations, taking tests, and social or emotional buffers. And the best example of this is strong and supportive caregivers allow a return to baseline to the body. This builds positive stress, builds motivation and resiliency. This type of stress is important for healthy development, and positive stress is not the absence of stress. Then there's a tolerable stress. This is experience of a greater magnitude. This has a stronger physiologic response. Examples of this are death in the family, a contentious divorce situation, natural disasters. And this too can be effectively buffered with supportive and nurturing adults, which reduce the risk that stress causes the prolonged activation of the stress response, and also buffers from negative long-lasting impacts on health and learning. The type of stress that we'll focus on a little bit longer, though, is this toxic stress idea that was brought up in the video. This is described as strong, frequent, or prolonged activation of the body's stress response systems in the absence of buffering protection or supportive and enduring relationships. Examples of this are child abuse and neglect, parental mental health concerns, persistent financial hardship or poverty. And this type of stress leads to stimulated child's reticular activating system, obviously leads to sleep disturbances. The elevated circulating catecholamines can also produce anxiety, suppresses the satiety center, which leads to obesity or higher rates of obesity, enuresis, and encopresis. There are known architectural changes that occur in the brain as a result of chronic and intense toxic stress, and these changes include atrophy of the prefrontal cortex, atrophy of the hippocampus, and hypertrophy of the amygdala. This is a picture of these structural changes, and we'll dive into that for just a second. The prefrontal cortex, you'll remember, is responsible for the executive function. This area of the brain is responsible for your working memory, mental flexibility, and this is where self-control is housed. And so if the atrophy takes place due to toxic stress, then you impact school readiness, math and reading competence, and positive interpersonal relationships. The hippocampus is another area that's affected by toxic stress. It is shown to have lower volume in kids who have had chronic or intense exposure to toxic stress. This area is responsible for memory and regulation of emotion. This impacts acquiring developmental milestones, and also can impact the likelihood of development of depression and anxiety. So toxic stress actually strengthens or causes hypertrophy of the amygdala, and this is the area of the brain that controls fear, plays a role in aggression, emotional processing, and then handling and using unconscious memory. And if you'll remember when in the first video, when she was talking about if you have increased myelination, you'll have more efficient nerve signals sent. That's what's going on in kids in this area of the brain who are exposed to toxic stress. So you'll see that they may have decreased inhibitions and increased aggressive responses. I have a feeling all of you have heard the term ACEs, or adverse childhood experiences. There was a large study done in the late 1990s through the CDC and Kaiser Permanente, I think, where they interviewed, I think, 17,000 adults and scored them based on exposure to adverse childhood experiences. And the examples of adverse childhood experiences are physical and sexual abuse, neglect, domestic violence, poverty, community violence, a variety of different adverse childhood experiences. And the study found that there was a direct correlation between later health outcomes, mental health and physical health, and it negatively impacted the more ACEs that you had been exposed to. So interestingly, I think 67% of people in the study had at least one ACE, But in people who reported 6 or more, there's a 90 to 100% chance of developmental delay. And then there's direct correlation also with heart disease, with depression, with diabetes, and lots of other negative physical outcomes as well. So closing out the second objective, just want to reiterate that the architecture of the brain depends on the mutual influences of genetics, which is nature, and environment and experience, which is nurture. Brains are built from the bottom up. Nurturing relationships build more capable and resilient brains. But the good news is that no developmental influence, whether innate or environmental, should be considered deterministic for a child. So that's where we come in. So in the third objective, I'd like to just briefly mention what can we do. As medical providers, it's important that we have kids coming in at the appropriate intervals for well child checkups, use surveillance and appropriate screening tools, listen, observe, develop a relationship with your patients, identify and address environmental risk early, utilize public health resources. There are lots available to us, and refer for interventions when indicated. I thought this was fascinating. Pediatricians are, according to this survey, the most trusted source of information for mothers of young children. They're going to come to pediatricians to ask about health issues, nutrition, diet, and parenting. So this is why it's so important that we understand these concepts in helping a child develop normally. Pediatrician advice is more fully followed than other sources. I don't know if I believe that statement, but that's what the survey said. So. What can families do to help children? Of course, nurturing relationships, that's the foundation of healthy child development, and that's going to be the buffer when they experience stress in their lives. Routine and regular meal times are important. Regular times for play and sleep, this helps children know what to expect. Of course, protection from toxic stress, providing a safe physical environment, good nutrition, developmental activities, and please limit screen time. In communities, early intervention programs are helpful, such as quality child care centers, Head Start, safe neighborhood, positive parenting programs, quality early education, WIC with access to nutritious foods and access to quality health care. This is just a slide showing the return on dollars invested at different stages, and the tan area to the far left shows intervention in prenatal programs. In the yellow area, programs targeted towards the earliest years, 0 to 3, and the gray, 4 to 5. So this Maternal Health Symposium is timely in showing why it is so important for us to understand these concepts. We'll get a better bang for our buck when we intervene at these times. And the final quote I'd like to leave you with is, "It is easier to build strong children than it is to repair broken men," quote directly from Frederick Douglass. So thank you. Are there any questions?
Good morning, my name is David Battle. Just 2 questions. Are there any other environmental factors that could cause ADHD, such as genetics or just environmental? And are there any other activities to improve brain activity that help with the executive function from your experience?
Of course, I don't think it's fully understood why every child has ADHD, and that's a complicated diagnosis to make as well. I believe that there is a genetic component. I believe that there is a home and environmental component, but being able to tell you exactly how much each is at play is difficult. What was your second question?
Second question is, are there any other activities to improve brain activity? I know they said something about playing with the piano. Is there anything else that you witnessed or observed?
Well, I think obviously reading to children, I think this parent-child interaction with the serve and return, I think Gosh, I don't know. Y'all help me with this. I think that so many, I don't think just playing the piano. I'm sure playing any instrument. I'm sure learning a language was something that one of the research studies that I read about. Think of any others? I'm sure that we could find a variety of different developmental, but reading is obviously important. That's a strong correlation there as well.
I would add, in terms of reading, I think it encourages it in the family. So a lot of times I'll ask patients, you have the library card, and so both mom, dad, and child should have the library card.
Right.
It's a great way to encourage them. There's a lot of online resources, videos, television. So I agree with reading.
Right.
Really using our public libraries is a great way to do that.
You know, and Anna, you said what are activities that you can have, which we just discussed, in conversation skills, but that leads me immediately to say again, reduce screen time. That's that, passive brain activity, whereas the active brain activity is a lot more helpful.
Question, with the second most common disability, autism, have there been any studies that have shown that the modernization, because you said the insulation is affected and that affects, have there been any studies that show that autistic children insulation was affected? Have there been studies like that?
I have not read those studies, but it doesn't mean that they aren't out there. So at this point, we still do not know the cause of autism. We think it's multifactorial, but I don't know the answer to that question.
Okay, thank you.
At least 200 genes which cause the autism.
Of course, different reasons, but at least 200 genes were found to be reason of autism based on Simon's Foundation. This is something well known, which are involved in neural activity and stuff like this. Oh, my name is Ilana Hetwitz, and I'm an associate professor here, and my expertise will be in cancer and stem cells.
Yes.
Hi, I'm Emily Nolan. I'm a labor and delivery nurse in Athens, Tennessee, and I'm a student. One thing that is continually I'm surprised by is on admission, so many of my expectant parents haven't chosen a pediatrician yet. And so I just, as an observation, I wanted to say that, when you're talking about the importance of
The first 5 years.
Yeah, exactly. And even the first few months, I'm seeing a big disconnect in communication with both not only just the availability, but frankly, parents even knowing that they should really have a pediatrician lined up before they come in to deliver. So I don't know if you have any thoughts on that.
I do think, well, I feel like today there's a better association between pediatric care than when I was growing up. I feel like we didn't really ever see a doctor until we were sick. So I do think there's better attention to that than there has been in the past. But I do think there is a pervasive thought that kids are just kind of on autopilot for a while. And I think, just reiterating that the first 5 years of life are critical for so many different aspects of life is important. Maybe as a labor and delivery nurse, you can help drive that home, that concept home.
Hi, I'm Linda. I have more of an observation than a question. In the video, it talked about the high fat being very important for the production of the myelin sheath. And it seems like when we talk about breastfeeding, trying to breastfeed up to a year because of the high fat content of the milk, why are we not looking more into nutrition in those younger years, less carbohydrates, less high sugar, less inflammation, and more into nutrition to help develop those dendrites?
Linda, I'll tell you that is, if I spend 30 minutes with a family at every checkup, I bet I spend 15 minutes talking about nutrition. And you will learn over time that some families are very receptive and interested in learning these things, and some are fairly closed to any changes in what their household habits are. And that's, again, it goes back to the importance of a pediatrician. They're coming so frequently, you're developing that relationship, and hopefully you can sense which families are ready to hear this conversation or not. But thankfully, WIC, as far as the high fat goes, WIC approves for kids 2 and under whole milk. And then after the age of 2, then they are allowed the lower fat milk, and that's part of the reason because of this, importance in brain development. Interesting, related to milk though, there's such a, it seems like there's a trend of use of almond milk, which is pretty low fat, and I'm having a lot of parents wanting to start to give their kids almond milk. So, what applies to adults does not always apply to kids because of the developing brain and developing body. But as to your point, we do at the Well Child Check spend a lot of time talking to families about nutrition.
I've been a nurse a long time and just worked with hospital, home health, and public health. I think sometime in the medical field we get so busy we forget how people best learn. But I find if you establish that rapport right away, but just showing them, we assume they know how to read to the baby or talk to the baby, and in a lot of cultures they haven't been taught how important reading is. But one of my things I actually do is I actually send them a hard book, 36 weeks to start reading to the baby, but I have to tell them why and what happens. And then I show them when they come in for the first visit how to sit the baby there and how I do it. I said, you don't have to read, because they said read to the baby. I said, you talk about the picture, you make the noises. And then some of them actually say, hey, my baby's cooing a lot and stuff. We have to take more time to show them.
Right.
Don't assume and listen to them. I find a lot of my claims are not being heard, I'm sorry to say, by the medical offices, that some of them may have been told things, but I kind of test them. I'll tell them what to do, put the questions in the phone, and then, I do a direct conversation sometimes if I can do it with one of the offices, but I really find they're not being listened to, especially
Right.
with the high blood pressure. I find that so
Much, right? And sometimes I think it takes repetition of the message before someone hears it as well. Maybe on the 5th time you tell them, they'll hear you rather than the first. So, are there any other questions?
I wanted to respond to the comment from our labor delivery nurse. Very good observation. So, and I'll talk about this when I speak later, but the second trimester is when we're supposed to be encouraging that relationship with a pediatrician. And so that falls on anyone who's involved in the prenatal care. It should happen in that second trimester period to really encourage them. And I tell my parents all the time, you take a lot of time to select a car, you take a lot of time to select your clothes, you want to take time to select your pediatrician, make sure you like them, because you're going to spend a lot of time with them in the first year. But really, it falls on the responsibility. Anyone involved in that prenatal care course, the second trimester is where that needs to be established. And we are missing the mark, and we can do better with that, but that's a great observation.
And Dr. Sumner wanted me to mention too the lack of pediatricians, especially in rural areas, which we're hoping to change over time with that table sitting right back there. So,
I had a question. So for the ladies who do trend to use the almond milk, what do you recommend then as another form of healthy fat?
Well, I just tell them to get back on whole cow's milk.
But what if they won't? I feel like there's a thing now where people are talking about it and how unhealthy cow's milk is and things like that. Is there nothing else that you tell them, or?
Well, I mean, breastfeeding obviously is best, but if a woman is not producing breast milk, or if her breast milk has dried up, then cow's milk is the best alternative.
Okay.
As long as the child can tolerate it and isn't allergic to it. And then that's a much longer conversation.
Okay. And then in terms of nutrition and ADHD, have you noticed that if you're educated about education, that they get benefits from the nutritional changes, or is it normally medicine in your experience that helps with ADHD symptoms?
So for every new ADHD patient that I evaluate, I will have a conversation about the importance of a healthy diet, appropriate meal times, cutting out sugary drinks. I have a long conversation with each family about that. And I will find a large percentage of the patients who present to me do have caffeinated beverages or lots of sweet drinks, but I also find that in the kids who aren't ADHD. So I reiterate that And that is a part of the conversation. If a child is younger than the age of 6 and they present to me, I will not put them on medication. I talk about sleep, I talk about nutrition, I talk about parenting. And to be quite honest with you, and this is just historical, so I'm not in the home really watching what's going on, but the parents always come back a year later and say, we cut those sweet drinks out and Johnny is still really active. So, I mean, does it help? I'm not sure. I think it is an important part of the conversation when you're diagnosing ADHD, but I don't think that's everything. Any other questions? Oh.
I know you mentioned the difference between surveillance and screening. So for specifically for ACEs, are there like screening tools to check for ACEs or like toxic stress, or if it's more surveillance, what kind of questions are kind of asked in the visits?
Well, great question. Yes, there are screening tools, and as a product of putting together this slideshow, I myself am learning about those screening tools. And they are available. They are not recommended yet as a part of the healthy or bright futures that we have to screen for, but I suspect that will be coming soon.
Thank you.
Any other questions? Okay, thank you.